It is my pleasure to introduce Dr. Nikki Nienhaus. She's going to speak to us about racism in healthcare and recognizing and combating implicit bias.
Good morning, everyone. Nancy, where'd you go? Thank you for your opening words. I really enjoyed that. I'm gonna come find you afterwards and talk. I hope my kiddo gets to do a trip like that with her grandparents someday. And Carolyn, I appreciate your music. It was beautiful. And I also appreciate you offering to create a distraction if I decided I didn't want to do this morning. I was a little bit nervous, and Caroline said that she would pretend that something had gone wrong if I needed her to, so. So my name is Dr. Nikki Nienhaus. My pronouns are she and her and doctor, if you would like to. My husband and I have been members here at the Ethical Society for coming up on 9 years, and we're very happy here. And we have a almost 6-year-old daughter named Lorelei, who, if you ever get the pleasure to meet her, is an absolute delight. I have been a chiropractor for, it was 6 years yesterday since I got my chiropractic license, or since I graduated from chiropractic school. And I have my own private practice, and then I also practice as the chiropractor at Jama Birth Village, which is in Ferguson. It is an equal access midwifery clinic that provides care to women of color and low-income women in St. Louis. And I've been there for, I think it's almost 5 years, to be completely honest. The years run together, so I'm not sure. It's either 4 or 5. And so I'm there 1 day a week providing chiropractic care to the patients and clients that we have there. Most of the women that we see there are receiving prenatal care through us and then going on to deliver their babies in hospitals and birthing centers around the area. Jama Birth Village is working towards having its own birthing center and kind of a postpartum retreat, which we're really excited about. We're fundraising for that. But right now it's just a clinic where families can receive prenatal care, and then they either can deliver at home with our staff midwife, or more often they're delivering in hospitals and birthing centers around the area. So I am uniquely positioned to be sort of adjacent to the medical community without actually being a part of the medical community. I spend, on average, more time with my patients than do their OBGYNs, because I have the luxury of working outside of the insurance system, and so I can do that. And so what that means is, for most of my patients, well, okay, let me start with this. Chiropractic care and why one might get it during pregnancy, so you can have a little understanding. One of the main reasons women seek chiropractic care during pregnancy is for pain relief, because pregnancy causes a lot of changes to the body that can be rather uncomfortable. And one of the things about pregnancy that's different than other times in your life is that most of the things we do for pain relief, like pharmaceutically, are contraindicated during pregnancy. And so these people are looking for pain relief outside of what their normal pain relief would be. And so they come to me, and I work on balancing the pelvis and balancing the muscles and offering them stretches and things like that so that they can be more comfortable. But what that means is that I see my clients a lot more often than they're seeing their OBGYNs. And so I get to hear their stories, and I spend that time with them, hearing their stories of what their previous pregnancies and deliveries were like, but also what their current care is like. And so a lot of what I'm going to talk to you about today are just things that I have learned in the 5 years that I've been doing this work that are maybe less than ideal situations for a lot of my clients to be in. So I wanted to start with a little history of, let me find the right page here. Hold on a second, you guys. Here we go. A little history of medicine in America and how that continues to impact medical treatment that people of color in particular are receiving in America today. So historically speaking, there are kind of 2 major things I wanted to talk about. I read this book, which I would recommend to anyone. It's called Medical Apartheid by Harriet Washington. It's frankly disgusting. Not because her writing is bad, but just because America's history is disgusting. So, but if you are interested in this topic at all, I would say this book is like more information than you would probably ever need. But one of the things that she talks about is this thing called the myth of medical distinctiveness. And this is really sort of the basis of where healthcare in America started. Along with most of our systems are inherently racist because, well, that's where we started as America, right? And so the racist part of medicine in America is this myth of medical distinction. Early American medicine, any and all research that was done either with the goal of proving that black bodies were inherently different and therefore worth less than white bodies, or they used medical experimentation on black bodies in order to perfect it so that when they did it on white bodies, it would be less deadly or painful or so that it would work. Which the cognitive dissonance there is just mind-boggling to me, right? That we're like working really hard to prove that there is a big difference between black bodies and white bodies, and then also doing research on black bodies for the purpose of using on white bodies. Like, how does that even work? I don't know. It boggles the mind. So, the myth of medical distinctiveness having two parts that I really want to talk about. One of them being that black bodies do not feel pain at all, or do not feel pain in the same way that white bodies feel pain. This was a part of all of the early research that, I hesitate to use the word research. I'm going to use the word research, but please know that most of the time research is not conducted this way any longer. There were two doctors. So again, most of my work is in maternal and fetal medicine. So I'm going to talk about the two doctors that perfected surgeries on their female patients who had been through pregnancy or were going through pregnancy. So there was a doctor, Francois Prévost, in the 1830s that perfected the C-section on enslaved people that he would either purchase himself or borrow from local slave owners. And so when the pregnant slaves would be going into labor, or sometimes not, just when they decided it was time for their babies to come out, he would perform C-sections on them, always without pain medication. And it was the 1830s, so it was, I'm imagining it in my head and it sounds terrible, but always without pain medication. Most of these women died. Most of their babies also died, but he practiced until he could get it right and could start performing the surgeries with pain medicine on local white women. The other doctor is Dr. Sims. He is, I forget his first name, and frankly, I don't care, but he is considered the father of modern obstetrics and gynecology. He perfected the fistula surgery. So just so you know what a fistula is, when a baby comes out, sometimes tearing can occur, and a fistula is when there is no longer a separation between the vaginal canal and the rectum. So these women were incontinent for the rest of their lives. So it was very difficult in the 1800s for women if something like this happened, for them to continue their lives. So white women would have babies, this thing would happen, and now they can't leave their houses anymore. They can't have a social life, they can't raise their children, they can't have any more babies, and there were just a lot of problems with this, right? So Dr. Sims said, I bet I could make a lot of money if I could figure out a way to give these women their lives back. So what did he do? Just like all logical people in the 1845, he bought 7 female slaves and practiced his surgeries on them repeatedly, again, with no pain medication, until he got it right. And then he could start selling them to white patients and make a lot of money. So a real upstanding fellow there. So this is where the history of maternal fetal medicine began, right? With practicing on black bodies and also not providing them with pain relief, which again, if the prevailing thought was black bodies don't feel pain, I don't know what they thought the screaming was during their procedures, but that was the overwhelming, the prevailing thoughts at the time. So today, that's where medicine started, and all people who became doctors, that's sort of what they were taught. I mean, because the history of our medicine came from trying to prove that there was an inherent difference in the races, which we now know is not at all true, and there is no difference in the races, but you'd be surprised how many people in medicine today still act in a way that they believe that black bodies do not feel pain in the same way that white bodies do. So, the myth of medical distinctiveness is part of the history that we have to talk about. The other part of it is poverty. So slavery ended, and we were just like, here, you're free, bye. And what we moved into is black people in poverty, right? Because they had been living on plantations and working, and they were given their freedom, but not given any means by which to create a life. And so much of the medical racism that we experience is also a bit because poverty continues to prevail in the BIPOC community. So I want to talk a little bit about what I think we can do to mitigate racism in medicine today. And I'm going to give you like some examples of, as I go along, of why this is important, okay? So the very first thing that I think is most important always when we're talking about work in anti-racist work is raising black voices and bringing and donating our money to the people who are already doing the work and joining in with the people who are already doing the work and encouraging black people to be able to tell their stories and lifting them up. White privilege is a thing that we all have if we're white. And so I think everyone in this room, white or white passing, it's a thing. Oh, not everyone in this room. Okay, I'm so happy. So I think it's important to use our privilege until we no longer have it. And by using it, I mean use it to raise black voices so that at some point there isn't a difference in the way that we think about it. So, raising black voices, donating money to people who are already doing the work. That's the first step. The second step is universal health care. A lot of what I see in my work is a difference in the way people are treated because they either don't have insurance or they don't have good insurance, meaning Medicaid or something like that. I have heard story after story after story from women who I had a patient once who delivered a baby with the doctor when she had Medicaid, okay? And then was delivering a second baby with the same doctor with different and what would be termed better insurance. And the difference in the way that doctor treated her, the difference in the way the people in the doctor's office treated her was so stark, like there was no way she couldn't have noticed. And she said, I swear it's just because my insurance covers more, so he's willing to run more tests. He's willing to listen to me when I ask him questions. Some of the things that I hear from patients with no health insurance or with Medicaid is that their doctors spend no time with them. Sometimes doctors order a lot of extra tests because Medicaid will cover them, but sometimes doctors don't order tests that really are needed because Medicaid won't cover them. Or if you don't have insurance and they know that you're not going to be able to pay for it, they just won't order the tests. And that is risky. So here's some statistics for you as to why universal health care is going to be really important. In the city of St. Louis, in the St. Louis region, about 5% of white pregnant people don't receive prenatal care. That statistic is 33% in communities of color. The difference there is mostly because of poverty and because of the lack of health insurance. But part of it is also, going back to that history, if doctors could never be trusted, and if you read this book, literally doctors could never be trusted, especially if you were a person of color, why would you go to the doctor if you weren't having any problems? So a lot of it is poverty. Most of those numbers are poverty, but some of it is also this inherent lack of trust in the medical community. Infant mortality rates nationally are about 5 in every 1,000 babies for white babies, and that triples to 15 of every 1,000 baby in black babies of color. And again, a large part of that is racism in medicine, but also a large part of that is poverty and being afraid to go to the doctor, or infant mortality is considered babies that die within the first year, but most of them are babies that are dying like in the first 3 months of life. And a large part of that is babies that are sent home from the hospital into situations that are unstable, because poverty is a large part of that. And then the last statistic I'd like to share with you. So black women in America are 243% more likely to die of pregnancy-related complications than are white women. Now, 243% is a lot. That's a really big number. There is no way that poverty is the only factor there. The overarching reason why 243% is black women are 243% more likely to die is because of racism, because their doctors don't believe them when they tell them that something is wrong, and because doctors don't think that their bodies feel pain in the same way that white bodies do, and therefore don't listen and don't give the same level of care. The other historical belief was also that black people were stupid and unable to care for themselves. And this is how white people rationalized slavery, because well, okay, I can't rationalize it in my head, but that is the rationalization that Harriet Washington talks about in her book. And so there continues to be this idea in medicine that we don't need to talk to our patients about what we're doing. We don't need to explain procedures or tests or things like that to them, because they can't understand it anyway, so why would I even try? And so a large part of that reason that black patients are dying more often is because their doctors aren't talking to them about what's going on in their bodies. They're not listening because they don't think that they know what's going on in their own bodies, and that not listening leads to things getting missed and then people dying. So universal health care would go a long way towards making it more accessible and insurances being equal, so that doctors don't make choices as to what kind of testing they're going to do for their patients. Okay, so then two things within the medical community that need to change. We need to change medical education accessibility. So historically speaking, and even up until today, it is getting better, but historically speaking, most doctors were white men, okay? And medical education is incredibly expensive, and so today, it's still primarily white people and wealthy white people that are getting medical education. And that's a very closed worldview. And so we need to make medical education more accessible to women and people of color especially, and because I have a friend who is a physician and a woman of color, and she shared with me once that one of the things that happens a lot at the hospital where she was at her residency, so like a group of doctors goes into a room with a patient, right? She is often the only person of color in the room and with the patient of color, right? So they're done, they do that like quizzing thing. Everybody's watched doctor shows, and some of them are relatively realistic. So they, what do you think's wrong with the patient? What do you think the best treatment plan is? Da, 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 da. And the patient sits there and nods, and then everybody leaves the room, and she says, 9 times out of 10, the patient will tap her on the shoulder and hold her back while everyone else leaves. And then they will say, what do you think? Is this the right plan? Are they giving me all of the information? Is this really what I need to know? Because that patient sees a face that looks like theirs and thinks, surely that she will tell me the truth, right? So if we can get doctors who look more like our patients, the patients feel safer, and they are safer. Research shows that black babies do not die as often if their doctors are black, and that black women do not die as often if their doctors are black. So we just need medical education to be more accessible so that patients are safer within the hospital. And along with making it more accessible so that incoming doctors are more diverse, we also have to increase implicit bias trainings. I hate to use that word. My friend says, I don't think we should call it implicit bias. I think we should just call it racism because that's what it is. And I tend to agree with her. But nobody really likes being called racist. And so to make it gentler and to get people in the room, we call it implicit bias training. They're getting better. Implicit bias training has historically not been great. You get, an hour of the doctor's time to tell them to, try to treat your patients equally, whatever. It has not historically been great education. But if we could retrain medical staff, not just doctors, nurses and anestheticians and phlebotomists and everybody that works in a healthcare setting, to recognize their own biases. It's ongoing work for everybody, but to stop ourselves and to recognize them, we could completely change the medical community. It's a time thing. This is a really discouraging topic when you start getting into it, you guys, because it's just, there's a lot wrong and fixing it feels really big. But I feel like we have to do the work anyway. Okay, so after implicit bias training, one of the other things in my work is doulas. So I work with people who are having babies. And if you don't know what a doula is a birth support person. So not a midwife, not a doctor, they're not delivering babies. They are literally there to support a person as they go through giving birth, and all the way through pregnancy. A lot of doulas go to doctor's appointments with their clients, and then they're there all the way through the labor. They help with things like natural pain relief and positioning, but another big job is when you're in the middle of having a baby, right? When you're in labor, your brain gets a little funky, right? Time feels long and then short, and it's not a comfortable process. And so if you're at a hospital and they're asking you if you want to have a procedure done, or if they're telling you there's something wrong with your baby and that we need to start interventions, you can't think clearly. And the job of a doula is to remind you of what your desires were before you went into labor, and to really help you discuss and decide what kind of interventions are what you want in that moment. What's great about that then is it's the same idea that I always recommend to people, everybody, that you take someone with you when you go to the doctor, for two reasons. Number one, because if you're at the doctor, you are probably a little nervous about being there. Most of us have a tiny bit of white coat syndrome, and so we might not remember to ask our questions. Having a second person is helpful in that. We might not remember what the doctor says to us, and having a second person is helpful in that. And often, if you're alone in an office with a doctor, doctors will say things to a single person alone that they won't say in front of others, that they won't say in front of family members, or that they won't say in front of other professionals, such as a doula. So that's where doulas become really helpful in the hospital setting, because doctors know that they can't get away with anything if there are multiple people there. So providing doulas is one of the things that Jamaa Birth Village does. We have a lot of doulas in St. Louis, and when clients call requesting a doula, we can provide them at little to no cost, and that helps. The research shows that having a doula at your birth decreases the need for interventions and negative outcomes, whatever that might be. Even like C-section rates are way decreased, epidural rates are way decreased, induction rates, just all of the things that are considered interventions decrease when a doula is present. And so then the last thing is recognizing and calling out our own privilege and bias. And I talked about that a little bit, but it really is an ongoing work. In the 5 years that I've been working primarily with women of color, I am continually surprised, and you'd think at some point I would stop being surprised, but I am continually surprised by how different life is as a white person versus for people of color. We live in a patriarchal, capitalist, racist society, and so for every risk factor you add on that, right? If you are not a cishet white man, there is risk in just living. And so I am not one of those things. And But the people that I work with are often not any of those things. And their lives are just, it's just often so surprising. And I just think we need to do the work to disentangle ourselves from our own biases so that we can bring life and equality and justice to the lives of these people who are just struggling a lot to live in a society that is not kind to them and does not treat them as though they have inherent worth. And we, as humanists, I feel like one of our jobs is to treat all humans as though they have inherent worth and to call it out when we see other people not doing that. And so that's really the work that I do in my tiny, small way. And I appreciate you letting me talk to you today. And I'm sorry that I'm ending early, but I don't have anything else to say. So thank you.
Thank you, Nikki. That was great. And I'm part of the establishment. I try in my own little way to be open and treat everyone equal. Okay, so actually I have a couple of announcements. Local honey is being sold in the Becker Room today. All proceeds will go to the International Institute to benefit immigrants from Ukraine and other countries. And James will come up and give us an announcement as well.
Good morning, everyone. I have a riddle